Okay, Dr. Ankur, thank you for joining me today on this show. It's an honor to have you here. I appreciate you being here with me today. I remember last time you interviewed myself, so now it gives me the great pleasure and honor to interview you back. And so, yeah, thanks for being here today. Just for those that don't know much about your story, just start off just briefly who you are, how did you start off, how did you find carnivore, and what kind of medicine do you practice as well?
Yeah, thank you so much for having me, Anthony, man. I mean, I've been looking forward to this, and it's actually my honor to be here with you, talking to your followers and your listeners and your group of friends and patients and clients. Uh, so my story basically starts, you can say about 18 or 19 years back when I was graduating from medical school. I started workouts, because wanted to be a fit doctor. And yes, I went to different gyms like everybody else does, and was under different types of trainers and coaches. And I used to eat everything that was out there. They would always say if you work out so much, you need your calories for that. And for me, obviously the macros were important. So and that is what we learned in medical school. Also, you need your carbs and proteins and fats. So yeah, I used to eat everything, but I was always a meat lover. And then I did my specialization in emergency medicine, and so I working in the EDs, and started seeing a lot of acute illnesses in patients, which we used to deal with. Save some, you lose some, and but my workouts always continued, right? But I used to get my calorie intakes 4,000, 5,000 calories a day, I think, probably, which included whole foods, yeah, my meats, even processed foods and junk foods once in a while. In 2001, I just got like a routine checkup done, and I saw that my triglycerides had hit 600, which was like a wake up call for me. My TG to HDL ratio was 16.86, which I did not know at that time because none of the lipid profiles show that to you. None of the doctors actually learn about TG to HDL ratio. This was I calculated later when I got to know about metabolic health and metabolic syndromes. But then, yeah, obviously, the triglycerides were something which was a wake up call, and then I figured I didn't know about nutrition. I didn't know anything. And the only thing I knew was that the TGs are because of my carb intakes. So I cut off all my carbs as much as possible. Actually, I cut off sugars first and all my processed foods first, and went into sort of like a keto. I went low carb. I used to have probably rice once or twice a day. No, sorry, once or twice in about 2 or 3 days. Just a small portion, but I would have my meats. But I at that time I still believed in the myth of total cholesterol. So I cut down on my red meats at that time, but not my eggs. I went into eating oats as a healthy breakfast. I
Mm.
did cut down my calorie intake. I was calculating my calorie intakes. Uh, and I did lose some weight. That has to happen. And then I bumped across Robert Lustig's book called Metabolical.
Mm.
He's a pediatric endocrinologist in the US, and that opened my brains towards metabolic health. And then I realized that it's not just about the physical health. It's about what's going inside your body, and then I started researching more into nutrition. The social media accounts of all the big ones, Sean Baker, Ken Berry, Robert Kills, and all. But then everything that they spoke about did resonate with me, but I didn't just follow them blindly. I did my own research. I went through the papers they used to talk about and many more, obviously. I went back to my biochemistry books, and then I realized about how important proteins and fats were. And then I understood the myth of cholesterol and statins and insulin and metformin and all of that. And then, you know, last year in April, I had lost about 23 kgs by then. And somebody sent me Paul Saladino's carnivore reel before he became animal based. Uh,
Mm.
and then I was like, this actually makes sense. And I've always loved my meats. So I cut off whatever remaining carbs I was having, and then I've lost another 3 or 4 kgs since then. I've become leaner. Libido's gone up. A lot of other symptoms have absolutely disappeared. And and then it's like sort of a matrix just opened up in front of me because I could see this pattern in my practice of emergency medicine. where people were coming in with acute illnesses, but those acute illnesses were because of the chronic disorders and the metabolic syndromes they were suffering from. Uh, I mean, complications of diabetes, hypertension, heart disease, all of that, fatty liver, thyroid, thyroid issues. And then we started doing a research where we were asking everybody's their diet preferences. It's 32 question survey. And it's not just about the diet preferences, but it includes everything, your junk food intake, alcohol, smoking, exercise, NOVA 1, 2, 3 list and everything. And then I've realized how rampant non-communicable diseases are in India. It's not just my department. That's just my department has so many patients coming in. I think about if I remember the data correctly, about 35 to 40% who coming into my department who are actually doing the survey. So whoever's doing the survey has a non-communicable disease like diabetes, documented ones, diabetes, hypertension, hypothyroidism, Alzheimer's, any other kind of dementia, Parkinson's, bronchial asthma, cancers, uh, PCOS, non-alcoholic fatty liver, and 2 or 3 more. So around 35 to 40% have actually entered the survey. That's a big number. That's a big percentage. Goes to show that 35 to 40% are the ones who are diagnosed sick, right? There'll be others who did not enter the survey. There are some who my team missed out on asking because they were really busy with other work. There were some who were brought dead on arrival, who obviously we did not ask to fill up the survey from the families, obviously. So this number can easily be way more than 35 to 40%. And most of them are diabetics and hypertensives. And most of them don't even have a good or half the adequate amount of protein or fats in their diet. And it's just mostly standard Indian carbohydrate loaded diets that they're having. Some of them have junk food, yeah, but it's not like they have it every day. They have it once a week, twice a week. There are some who don't eat junk food at all, like the Jains, who have only whole food carbohydrates every day. So yeah, so that patterns there. I'm like, this. I mean, as a doctor, I was never trained in curing anybody. I thought I was, but then it just opened up my eyes again that even as an emergency physician, I might be saving your life at that given moment, but I don't know what's going to happen with you 2 months from now or 2 years from now. I'm not curing you of the disease that you came in with. You might have come in as a pre-diabetic with a heart attack, which is not diagnosed earlier, and you came in with 0 medications. You've been discharged on 10 medications. 4 would be for your acute stage. The rest 6 would be for probably lifelong. Your cardiologist is going to keep you on antihypertensives, on statins, on blood thinners and all that. Some of those medications are required. Some of those medications are not required, but you'll still be on them. And those are also metabolic poisons for you. You have a lot of side effects, but you'll still be having them, and you'll still be eating your crappy diet, and you'll still be on your medications. You'll still need to, go into heart failures. You might have a heart attack again because of that food that you're eating. And probably second time around, I might not be able to save you, but
Yeah.
I can still save you from coming back into the emergency department or never coming into the emergency department if you just sit at home and eat the right food and not get sick. It'll not take you to the stage where you need your life to be saved in my emergency department. So that's become like a motto for me, a mantra for me, that I'm trying to push uh, for the Indian population at least. I mean, you guys are sick. There's a lot of visceral fat roaming around in you. There are a lot of pot bellies roaming around. India's population is huge. You look around anywhere, you turn your head around and you'll see only pot bellies everywhere, be it gyms, be it football fields, be it schools, be it offices, malls, anywhere you go. And most of these people have just normalized it, and
Yeah.
they think that they're not sick because they've never got tested. They might fall ill once in a while, or maybe once a month have some sort of an infection, which would obviously nobody will tell them it's because of how their immune response is or what their immunity is all about, what their inflammation is all about. Nothing like that. And they just take it as it goes, and yeah, and then they just start to die off. So yeah, I mean, that's my kind of I mean, sort of my story. I've reversed diabetes, hypertension, hypothyroidism, non-alcoholic fatty liver, and infertility in some of the patients that have been consulting with me in family and friends. I've seen that. I've seen people turn around. So it's possible to do it.
Mhm.
Uh, and yeah, I keep having these discussions with my family, not my family actually my family, my in-laws basically, who are mostly vegetarians. Today only I had like a 2 hour talk with them, just to let them know what their protein intake is all about, what their fat intake is all about. One of them's had a heart attack earlier. I'm like, if you eat healthy, why did you have a heart attack? You need to know that. He's like, yeah, I don't understand why. I said, yeah, so I'm
And
going to tell you why.
Uncle, where are we getting this from? Like, I know where we're getting it from the Australian dietary guidelines and the American diet, but where is India getting their dietary guidelines as to what they should be eating? Where is it all coming from? Is it based on culture and cuisine and tradition? Is it based on, are they getting some authority elsewhere telling them this is how they should be eating?
They're getting the guidelines from the West for sure.
Mm-hmm.
Definitely. This is about the plate and the food pyramid, how you should get 60 to 70 calories, 60 to 70% of your calories from carbohydrates, fruits, vegetables. Your plate should be green. You should have cereals, nuts, and grains, and just a little bit of animal proteins or fats. It's the same over there. And it just gets magnified because of the culture difference also. I
Mm-hmm.
mean, and that's again a myth. A myth in the sense that India never used to eat meats. India has always been a meat-eating country. There are a lot of papers, there are a lot of books written, even in the Rig Veda. I was just reading right now. Even in the Rig Veda, it's written that Hindus used to eat beef. The Brahmins used to eat beef. If you look at this book called The Untouchables by B.R. Ambedkar, who was one of the founding fathers of independent India, he's done his own research. And when the untouchables started eating beef, that's the time the Brahmins said that, if the untouchables are going to eat that, we will not eat it, because of the hierarchy system in India and the caste system. And they made it a sin. So and obviously some religious reasons also. So that was the thing. But yeah, India is now a largely vegetarian population, and they're still being promoted the same kind of diet that they actually eat, but it's not getting better.
Mm.
you know and the research that I'm doing, a lot of people use ghee and mustard oil, which are still really nice oils, right? And good to use. Not many people use the refined seed oils in their foods. There is sunflower and rice bran and soya bean and canola and all that, but to a lesser extent. They're still
Mm.
using ghee, which is the healthiest. Indians still believe in the ghee. But then what are you cooking in the ghee? You're doing rice, you're doing lentils and legumes, you're doing
Mm.
vegetables. And so if you're not getting animal proteins and fats, your diet is mostly carbohydrate. That's the only macro that's left, right?
Mm-hmm.
And people still don't understand the myth behind proteins in lentils and legumes. They believe that is there. They don't understand essential and non-essential amino acids, bioavailability and biodigestibility, anti-nutrients, the phytic acid that's there.
Mm-hmm.
It's really difficult. And then you have the same nutritionists in India say the same thing again and again, because they've been taught from that same school.
Yeah. And
So
so
that's the problem. So it's like a mixture of both.
you're getting it, you're getting it from different avenues, and people are still not, they don't seem to be getting the message, in spite everyone, people around them dying. It was 1 in 6 people at the moment globally actually in that have diabetes are from India. 1 in 6, I believe,
Yeah,
it's what
yeah,
it is
yeah.
for diabetes. But
17 so 17% of the diabetics from the world are from India.
coming from India,
And 70% of the population is overweight. 70%. If that's not number one, it might be very close second to the US.
unbelievable.
And I think it'll be more than 70% for sure.
What about because India has the cow is a sacred animal in India, and it's the very nutrient dense food that many carnivores thrive on.
Yeah.
What's the belief behind that, and will that ever change?
I have no idea if it's going to change, because there's still a cultural difference, because in the south of India, there are a lot of Hindus that stay there, and they eat a lot of beef.
Hmm.
It's there. It's mostly problem in in the northern parts of the country,
Yes.
north and northwest. So it's got to do with religion and politics both. You know how politicians also play with the religion, and it's always a propaganda. Like I've already mentioned that people don't know that Hindus used to eat beef, and due to some other reasons, some propaganda, it went down. Even the first Ayurveda book written by Charaka in the year 300 to 400 AD, they've mentioned 550 different types of meats, including beef, to get healthy, to remain healthy during pregnancy, to be consumed. And
Interesting.
and it- and in today's Ayurveda books and teachings, you don't get to see that.
Mm.
So there's always been a propaganda somewhere. I don't know who started it off. I'm still trying to find out who did. But yeah, I mean, people should know. But that's okay. I mean, even if we don't get beef, we have a lot of other different kind of red meats. We get a lot of pork over here. We get a lot of lamb and goats over here, and pasture-raised goats. I mean, th there's not a big industry, so you have all the butcheries, and wherever you ask, how do you keep your goats? No, they're like, they just roam around freely wherever, nomads. That's where they source it from, which is still better. So yeah, we get that. We get those red meats at least, and we get a lot of buffalo, water buffaloes. Yeah,
Oh, right. You do too, actually. Yeah. So
yeah,
buffalo would be another option that people eat.
yeah, yeah.
Um, where do you stand? You've got, when you go carnivore, keto, clearly you're going to be a part of the minority now. What's your posture like around fellow doctors? What's your posture around family members? Like, how do you stand behind this? Like, how do you present yourself, and what's your reactiveness like,
So in my department, everybody knows what I look like before I went carnivore and after carnivore.
Hmm.
So they don't need any explanation. They listen to the podcasts that I do and all that, and they're doing the research. They're my manpower who are conducting the survey, right?
Hmm.
So they're seeing it head on.
Hmm.
They can see it. Even if they're vegetarian, they've started to tell the patients start eating some meats.
Yeah, wow.
Even if they're vegetarian, I mean, they've understood that. And I keep telling my vegetarian colleagues and my residents and my nurses, can you see your future right in front of you on that bed right now? They're like, yeah, we do. So,
Yeah.
I mean, I don't know if, it's not that a switch in their head is going to go on overnight, but it has to be repeated, 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 and that's for anything, right? I mean, it's not my propaganda, but I've put out the information out for them, and they're doing the survey themselves. They've started asking. I tell my nurses, "You're a vegetarian, right?" Yeah, yes, sir. Okay, just go ask that patient what he or she eats, and then they come back. They eat the same thing that I do. Exactly. So now you understand what's going to happen with you if you eat the same way. And they do understand, like, how should we do it? Some of them are curious enough to sit down with me and understand how they can switch. I'm like, you start off with eggs. Yeah, I'm not telling you to start eating red meats, a meat that you've not eaten ever in your life for the past 20, 25, 30 years. Start off with eggs at least, see how it goes. The only thing is it's in your brain. You have to know you're doing it for your own health and for your own future, right? So it's not that difficult talking to my team at least.
Yeah. What
But
about family?
just 2 days back, I was talking to a neurologist, and he saw some of my posts on, like, you become a big speaker and all that. And like, yeah, but do you understand what I'm talking about? And I told him that, the last stroke patient you saw, you started him on statins. I'm not telling you you should not, because it's there in the guidelines. If you don't, and these guys go out with the discharge summary, somebody can easily get you sued that, this thing was written in the guidelines. Your doctor did not start you on these medications. He's trying to kill you. I understand where you're coming from, because that's what you've been taught. That's what we've been taught. But just see the guidelines. They've never mentioned check the lipid profile first. And if the cholesterol is high, start statins. If they really want to do that, I'm not saying that you should bring down the cholesterol levels, but then the statins are used to bring down the cholesterol levels. At least check that the cholesterol levels are high or not. That's not required, and that is not recommended. It's just recommended that you do it blankly and blindly.
Yeah.
It's like a blanket rule. You start all of them. And I asked him, just check and I told him, I have seen your patients' lipid profiles whenever you've got it done. I've seen them. They're absolutely normal, or they're like low normal, like total cholesterol of 90, LDL of like 85, 90, 95. Then why did you start them on statins?
And what
And
do
they're
they
like,
say?
yeah. He said, yes, that does make sense, but what should we do? Like, you need to raise awareness. You
Oh,
need to
right.
fight the system. Yeah. So yeah, and family again. So my brother's gone carnivore. He went carnivore in March this year. He lost a few kilos. He's
Okay.
feeling much better. He used to have this finger pain, and he was on statins. I stopped his statins,
He was taking
and then
statins.
yeah, he was taking statins, and his cardiologist in Canada went nuts because he did a lipid profile over there, and his total cholesterol came out to be 600 or something. I'm like, that's just your body's reaction right now because there are changes happening in your body. It's probably producing more, and you've stopped your statins, so there
Mm,
has to be a rebound also. Because your HMG CoA has been dormant for so many years, and now it's just flared up back again.
mm.
So there might be some rebound. Give it some time. It'll settle down. Don't worry. Your calcium score is absolutely zero. And then he came back. He came to India for the last 1 month. He's been there, and we got his levels done, and his total cholesterol gone down to 300 automatically. Without being on statins, it came down from
Without.
600 to 300. Yeah.
What you said earlier about the TG to the HDL
HDL.
ratio.
Yeah.
But for the viewers out there not knowing about this, what would be classified as indicated? What would be classified as something that should be, people to be striving for?
Yeah. I mean, the ratio should be less than 2.
Less than two.
My
Yeah.
less than 2. Mine was
Mm.
16.86. Imagine
Wow.
that.
So your
I,
triglyceride over your HDL, that was
yeah.
16.6.
Yeah.
Wow.
16.86. Yeah. And now
Mm.
it's 1.6. So it
Yeah.
hovers between 1.3 to 1.6. So yeah, for the
Mhm.
listeners, the triglyceride should be as low as possible and HDL should be as high as possible.
As high as
I
possible.
mean, yeah, 80, 90, I think that should be fine. I
Yeah.
don't think it's going to go above that. I mean, your genes are going to take care of that.
Yeah. India has a very high there's a big training influence in India. A lot of people want to exercise. There's a big gym culture in
Yeah.
India, but a lot of them are still fixated on, the chicken and the rice and the multiple meals, the oatmeal and that sort of stuff, because a lot of the great bodybuilders that are in India, they see how they look like and they want to emulate that. So what's your take on
Yeah.
this?
So yeah, again, and it's not just in India. I mean, if you see worldwide carbohydrate intake for training and for bodybuilding, over many years, it's been in vogue. I think earlier in the 50s and 60s in the US and all, it was mostly beef and eggs, right? Steak and eggs. But then carbohydrates came in,
Hmm.
and people do build a good muscle mass because of the carbs, but they don't understand is that those carbs are basically getting converted into fat, and that fat is getting inside your muscle, right?
Hmm.
So your muscles would be a little, pulpy. You would have that kind of fat inside your muscle, and not many people know that,
They
right? So
confuse it as
that's
glycogen, by the way. They think
yeah,
that
yeah,
just, for every gram you're holding 4 grams of water, converts to polymer, and then you've got all this, like they're saying 70% of the muscle is water, and now they're having carbs and it fills them out. But you're right. A lot of that's intramuscular triglycerides, isn't it?
yeah, exactly. And I mean, if they want to look at an example, in the food industry, you want nice, soft, fatty meats. They're
Mm,
fed grains and carbohydrates.
that's so
Why?
true.
Because the fat gets inside the muscle, and that's when you see the marbling on the muscle. It's all the
That's
the
so
the
true.
white part, and that's all fat, and that's more expensive. Even in Australia, when I wanted grass-fed beef, it was cheaper than grain-fed. I'm like, give that to me any day. It was cheaper. So higher the marbling score, the more expensive is the meat because it's softer to eat and chew, right? And
Yes.
it's softer because of the fat inside the muscle means that you've actually made the animal also sick. And the same thing happens with us. And it's not just the muscles that get the fat, you get visceral fat too.
Yes, it's not just it's the internal organs, the vital in the peritoneal cavity, everywhere else, isn't it?
Yeah, and
Far
I
out.
was talking to Sean O'Mara yesterday, and he's an expert on body fats. So these two are not the only fats you have, right? You have subcutaneous fat, and then you have that subcutaneous fat divided into deep and superficial subcutaneous fat. And the superficial subcutaneous fat is what you need, is the one that you can pinch.
Pinch.
That's the one that you actually need, and that should be there.
Mm,
And the deep subcutaneous fat, the two divided by the scalpa fascia, and the deep subcutaneous fat is the one that you don't want.
mm.
So you have your subcutaneous fat, superficial subcutaneous fat, you have the scalpa fascia, and you have deep subcutaneous fat. then your skin. Then you have your muscles that might have fat in it. Then you have your abdominal organs that might have visceral fat around it, and your heart. So you have these 3, 4 layers, right? So you want fat only in this superficial subcutaneous layer that you have. You don't want fat inside, and you don't want fat outside and between the scapa fascia, and you don't want fat inside your muscles.
Mm.
That's going to choke you. And he said he actually challenged anyone, Google whatever disorder you have along with visceral fat, and you will find a link to that.
Yeah, and there is a strong, he's a big proponent of sprint work to eliminate visceral fat. Can you just briefly
Yeah.
touch on that?
Yeah, so he spoke about sprinting versus jogging, and not just sprinting. He said any high intensity work,
Mm.
even lifting weights and lifting heavy weights in shorter periods of time
Hmm.
with high intensity and
Yeah.
sprinting. They release myokines, which actually help in burning the visceral fat faster. And
Mm.
if you jog or do like marathons, you don't activate your fast twitch muscles. Also, you only activate your slow twitch muscles, and end up losing you end up releasing more of cytokines, which are going to burn away your fat, and your not your fat but your
Muscles.
muscles. Yeah, your muscles.
Yes.
You can see the difference between a marathoner, even a world-class marathoner, and a world-class sprinter. You can see the difference in their bodies. You can see the difference in their body composition also.
Fascinating, man.
So that was really fascinating. And he's somebody, I mean, he's got such a fantastic profile. Somebody who was a cop, who then became an undercover narcotics agent, then became a
Yeah.
criminal advocate, then did emergency medicine in the US Army, and now he's doing this.
How
I think
crazy is that? What a
just
story
another
he's
level. Yeah, yeah. He's just another level. Yeah.
Amazing, amazing. So when you started carnivore, like
Mhm.
you went from the traditional eating the carbs, and then you found out your triglyceride count was through the roof. You decided to go on the ketogenic diet.
Yeah.
Then you stumbled on Saladino and so forth. Did you ever entertain the fruit and honey sort of thing that he advocates?
Not the fruit. I have a little bit of blueberries sometimes when I think I'm
Mm.
having an oxalate dump.
Yes.
Because as an Indian, I've had a lot of oxalates. We love our potatoes, which are rich in oxalates, right? So
Mm.
potatoes, spinach, beetroot,
Mm.
and then I had oats for a year when I was doing keto, and
Yeah.
my my jaw had started clicking, and I couldn't figure out why that was happening. It got stuck a lot of times, not like a proper lock jaw, but this was something which I could voluntarily lock and unlock, and used to
Hmm.
keep clicking during yawning when I used to wake up in the
Like
morning. So
TMJ?
yeah, both my TMJs, yeah.
Mm.
And I showed myself to my oromaxillofacial surgeon. And I'm like, what the hell is happening? And he's like, just do some exercise and you'll be fine. I'm like, do I need to do an MRI or a scan or something? He's like, no, not required. Just do exercise, stop chewing gum. Yeah, I used to do that earlier. But then I'd already stopped. I've already stopped since I went keto. So uh, couldn't figure it out. And then when Saladino happened, I stopped having oats. And within a month, I realized this is gone.
Wow.
And at that time, I didn't know about oxalates. I was still doing my research. And then when I got to know about oxalates, I realized this has to be that. It can't be anything else. It just cannot be anything else.
Yeah. So when you were saying sometimes you're having blueberries, what's the reason behind that one? What does it do with the oxalates?
So blueberries has a very low amount of oxalates. What oxalates does is it gets stored in your body in different areas,
Hmm.
right? And then once you're oxalate free, not eating any oxalates, there's an open highway for for the body to remove these oxalates, because
Okay.
it's toxic for the body. These are crystals, right? And
Hmm.
they can chelate calcium and store as uh, you know
Stones.
uh, yeah, store as stones
Yeah.
in the kidney, ureter. They can cause arthritis, gouts. They can go up to your thyroid and block the absorption of iodine, cause hypothyroidism. They can
True.
also crystallize in the breast tissues and cause breast cancer. There are studies regarding that where they've actually done biopsies of breast tissues.
They found
Where
oxalate stones in there.
yeah, they found oxalate stones in there.
Fascinating.
So when your body actually starts to dump all of these oxalates, you might have a rush of symptoms. It can be from palpitations to, some old pain just flaring up, or some other kind of a joint pain and stuff. So if I feel something like that is happening, I have a few blueberries, or every 4 or 5 days, I have a few blueberries. Sometimes
Hmm.
just add some cream onto it, just
Nice.
for the fun of it. Yeah.
Yeah, I sort of when I hand in my carnivore card from time to time, I'll do a Greek bit of Greek yogurt with blueberries in there,
Yeah.
so it hits the spot. So
Yeah.
all right, so now you're in this space now. What is your movement? What do you want to achieve now? What motivates you moving forward? Are we from a medical perspective? I guess from social media. What's your what do you want to try and achieve?
I remember I actually became a doctor to cure people.
Mm.
And as a doctor, I'm not doing that.
Yeah,
Even as an
wow,
emergency,
man.
even as an emergency physician, I'm not doing that. I'm just saving your life at that time, but I'm not going to cure you. So
Mm.
that's become a motivation for me to actually, I can't cure everybody for sure,
Hmm.
but I want to raise awareness, put the right information out there,
Hmm.
try and switch as many doctors as possible. That's the first thing. If I have doctors who change, even if they don't change, if they understand and they don't take the change onto themselves, okay, fine, I can't do this, but I can ask my patients to do this. That is still okay with me,
Yeah.
you know. And so that's become my agenda now. So whichever conference I go to in India, I'm like, just give me this topic, and I've understood that metabolic health and emergency medicine are linked. Uh, Deaths due to non-communicable diseases used to be 30% earlier, about 20 years back or something. Now it's 60%. And most of those deaths happen through the emergency department or before you reach the emergency department. And like I mentioned, most of the disorders, heart attacks, strokes, aortic dissections, hypertensive urgencies, brain bleeds, diabetic ketoacidosis, hypoglycemias, even communicable diseases where your immunity is so low, chronic kidney disease, uh, ulcers, amputations, gangrene, all of these are due to these chronic disorders, which are absolutely reversible and curable only if
Wow.
you eat the right diet. So I mean, that's become my agenda to raise that. Even in November, I have to go for our national conference where I've told the scientific committee I'm going to talk about metabolic health and emergency medicine. Give me the right time where we'll have the maximum number of audience so that I can do my thing.
Great. When it comes to um, healing people and getting them on the right path of health, what are some of do you have any pillars? Do you have any go-tos? Like, of course, eat the carnivore diet, whatever, but do you have any, how do you get people into this space? Because we're talking a lot of people they've gone from not eating much meat at all to now having to just switch over, get rid of the rice, get rid of the potatoes and so forth. What's your transition like? How do you approach it?
I think mine is I can call it like shock and retreat.
Yeah.
So, I tell them, you're having this diet, vegetarian diet, you're clearly sick. What you need are meats. And they're like, are you sure? Because the other doctors tell us not to. And then I'm like, do you really want to know? They're like, yeah. I'm like, come inside. And then I tell them to ask me questions first.
Mm.
What are the things that they're worried about if they start having meats or eggs? So the
Yes.
first thing they start off with is
Cholesterol.
cholesterols. Yeah,
Yeah.
that's the first thing they start off. And I tell them the whole thing. I show them some images, some pictures, maybe some anonymous reports of my previous patients. Oh, this was the cholesterol level. This is what's happened. And maybe show them some social media information that's out there uh, by by credible people. Uh, and then I start answering all the questions. Then I'm like, okay, do you know anything about macro and micronutrients? Like, yeah, we know about proteins. I'm like, but you don't getting any proteins. But you know what kind of proteins do you need? What
Mm.
are essential amino acids and non-essential amino acids? They don't know, so I write it down for them. This is what they are. Do you know where you get them from? No, I'm like, this is where you get them from. And then so I have like two sheets with all the macros, all the micros, and where you get them from. What is the bioavailability and biodigestibility? What are the myths and all that? And I tell them, do your own research. Take this paper with you. It's with you. Do your own research. Whatever I've written on this paper, you will find this wherever you want to do your research from.
Yeah.
You will
Wow.
get this. And I tell them, you tell me any other doctor, who's ever sat down with you to tell you why you're actually having these diseases.
You
That gives
know,
me probably some kind of a credibility, and they've been telling me, yeah, I mean, nobody's ever told us this, nobody has ever spoken to us like this, and nobody's given us 15 minutes of their time to actually tell us that my diabetes or my hypertension is because of my food and not because I'm growing old or because of my genes.
how different your approach is to how conventional allopathic medicine is approached. You say,
Yeah,
this guy is sitting down with you for 15, 20 minutes, as opposed to spending a few seconds just to pass on some some high blood pressure, hypertensive medication or any statin or whatever. You're spending time with them. Clearly they're seeing it, right? And
yeah,
I
and
love that you ask, I love that you ask questions. I love
yeah,
that because it teaches them how to think, doesn't it, when you ask the questions?
yeah, that's really important. Just to
Mm,
ask why. Even if you know the answer, just ask why. And that's what I teach my residents. And they've started to understand. I mean, we had a patient with a diabetic ketoacidosis. For your listeners, that happens when your sugars go really high, like 400, 500, mostly because you've not taken your insulin shots and you've eaten a lot of food, and you come in and your body's is producing a lot of ketones and ketoacidosis,
mhm.
beta hydroxybutyrate. And the doctor who she was getting admitted under came and told the whole family that, and told the patient that, you better not stop taking your insulin. This is going to go on lifelong. You'll die if you don't take your insulin. This is never going to get cured. This is a lifelong disease. And my team was standing behind him, just looking at me and smiling, you know,
Have you
because
have you I interviewed Dr. Gary Fettke about a month back, and he's had like all sorts of people try to bring him down. Have you had any medical board, anyone in try to sort of like speak to you or at all? Or
not yet.
not yet.
Not
Okay.
yet, not yet. I'm still see, the good thing about my practice is I don't deal with chronic diseases.
Okay.
I save your life and I send you to your specialists, right?
Okay.
You can come to me out of your time.
Mm,
And in India, it's not necessary that you need to follow the same practitioner.
okay.
That's there in the US, maybe the UK, and I don't know about Australia, but you have these doctors empaneled with your insurance companies, right? In
Yes.
India, healthcare is so accessible that you have the luxury to get 7 different prescriptions from 7 different doctors on the 7 days of a week easily.
Okay.
So, I mean, once they're out of the hospital, they can always come to me. I won't stop their medications. I can always say, okay, fine, this is what you do, and you chart your results. You can go back to your primary doctor, tell him, okay, fine, my insulin is this much, my HbA1c is this much, my sugar is this much. Should I stop my medications or not? Or you only be with me. I'll stop your medications. Follow me for 1 or 2 months, and you see what happens.
Yeah. And some do, some don't, right? Some do.
Yeah, yeah, yeah,
Yeah.
absolutely, yeah.
Amazing. Run us through your typical day in the life as far as like how many meals a day you eat. What do you gravitate towards? Do you have any macros? Like what are you roughly on at the moment?
Yeah, so I've actually upped my protein intake after I spoke to Richard, Keto Pro Richard Smith from the UK, and
Oh
I'm
yes.
I'm yeah, I'm trying to do about 1.5 grams per pound of body weight protein intake a day.
Massive.
Uh, yeah, and I'm
Yeah,
doing
wow.
3 days a week workouts after I spoke to you. So push, pull, and legs with
Nice.
recovery days in
So
between, and
1.5
weekends off.
grams. That's massive. So what do
That's
you
about
weigh?
200. It comes to about 200,
200.
210.
Okay.
Yeah,
Is that
yeah.
per current body weight at the moment? Yeah, in pounds.
Yeah, yeah,
In
yeah,
pounds.
yeah, yeah.
Okay, great. Have you noticed any changes made, any changes to your body since you've done that?
Yeah, I'm gonna do my bioimpedance tomorrow just to have a check again
Oh,
because it's been
great.
about 2 or 3 months. I just want to see how much fat percentage I've lost, or if not, how much muscle gain mass I've gained.
Yeah,
But I definitely feel much better. I definitely feel much leaner. I'm
great.
sure I look leaner. I don't know. People are telling me that I've bulked up, and the good bulk, lean muscle up more.
Mm.
Uh, I keep asking my wife and I keep bothering her. Do you see any changes? Do you see any like I see you every day. It's
I
not
have
easy
to
for me
say,
to
I have
notice
noticed
changes.
changes. I've noticed changes because you've posted some things on Instagram and I've seen
Yeah,
your physique is definitely, you're a lot leaner than our catch up a few months back. Definitely a lot
Oh,
leaner, man. So yeah.
that's
So what would that
absolutely
look like?
fantastic.
The 200 grams of protein per day. How many meals a day do you eat, and what kind of foods are they?
So yeah, I'm doing 2 to 3 meals. Weekdays
Nice.
is 3 meals. I have to do 3 meals because I have to go to work. So I
Hmm.
start off with like 5 or 6 eggs in the morning, and then I have about 500 to 600 grams of chicken or red meat or seafood in the afternoon,
Hmm.
and the same in the night.
Hmm.
And try to hit 200 grams of protein. And I've seen pork is really easy to do that over here because pork has really nice. It's quite nutrient dense in terms of protein and fat intake.
Yeah, it's fatty.
Um, yeah.
And do you have
So
it
so
with bacon? Is
that
it bacon you do it with?
no,
So
no, I do with pork chops or pork
pork
ribs.
chops. Oh,
Yeah, yeah.
fantastic.
It's very nice.
Yeah.
So yeah, I do. So that's what I do for my 6 days. Sundays I may not calculate things because now my son's football started off. So like today morning I did a black coffee with some MCT oil in the morning itself when I took him for football, and then I came back. I've had about 6 or 7 eggs before we started chatting. Uh,
Nice.
yeah, I'll have some bone broth once we're done. Uh, and then yeah, I'll see you dinner is I think chicken wings or something. So chicken wings is easy. I mean, it's got a lot of proteins. I've seen that, and I can easily do 400 or 500 grams of wings. I think yeah, I should.
That's great, man. Awesome.
Yeah.
Well, how can people access some of your work? If I want to check out some of your podcasts, like let's say Richard's podcast or what you did with Sean Amara, where can we find all this stuff?
Yeah, so my podcast is on Spotify, Apple, and Google. It's called the Desi EM Project.
Mhm.
DESI EM stands for Emergency Medicine Project.
Yeah.
It's out there over there, and you can follow me on my Instagram. It's called the carnivore.ep. EP stands for Emergency Physician. Yeah. So
Yeah.
normally, so I think Sean and I probably would be the two emergency physicians or carnivores that I know of.
Wow. Well, I want to say, man, I really appreciate the space, the carnivore space, and how we've got some pretty massive artillery behind us. We've got so many doctors that are doing this now. That's enough. It's the most
Yeah.
respected profession on the planet. And when you hear of a doctor being a carnivore, that tends to raise a few eyebrows and people saying, okay, maybe there's a lot of merit. I have to check this out deeper, you know? So your
Yeah.
profession as it stands is, it's edifying as it is being a doctor. So I just appreciate your ability to set the example, to do what's right, and what you said earlier about you're not actually helping. You got into medicine to help people, and the Hippocratic Oath is do no harm to your patient.
Yeah.
And you're doing exactly that with this diet, man. So I want to thank you and appreciate all the work that you do and how you're striving to make everybody healthier.
Yeah, thank you so much for having me, Anthony, man. It's been an absolute pleasure. Yeah. We'll keep
Cool.
working with you. We'll keep collaborating for sure. And let's take the world towards a healthier future.
Thanks, man. We'll catch up again soon. Take care, Uncle.
Yeah.
Bye.
Cheers, man. Bye. Cheers.